get it by inhaling the spores.
Yeah.
Yes. Everyone will inhale the spore. You and me can inhale the spores. But now the difference is going to be in how strong your immunity is.
Yeah.
Once you inhale the spores, they will be dormant in your lungs. But at the stage or at the time when your immunity becomes low, or when does somebody's immunity becomes low, get HIV, and like we said, you are not on ARVs, or you're not taking your medication the right way, or you have taken and stopped, your immunity will go down because now HIV has more power on your body because there's nothing else to stop it.
Yeah.
So once the immunity is low, the cryptococcus, which was dormant in your lungs, will become activated. It will become activated, it goes into blood, and maybe if it is not treated, once it is in blood, it will keep on multiplying and multiplying.
Yeah.
Before you know it, it will cross and go to the brain. Now, once it is in the brain, we shall say that you have cryptococcal meningitis.
Oh, thank you so much, Paul. Dr. Jenny, what are some of the things that a patient will complain about? And when they come to us, what are some of the things that we can examine and actually see that they actually have cryptococcal meningitis?
Thank you very much. So patients usually come in about 3 to 4 weeks after they've had symptoms. These patients have maybe had a fever and headache, the worst headache of their lives, and they've gone to maybe a nearby clinic and they have been treated for malaria. Sometimes because they have a fever and headache, they think, oh well, it's malaria, so they've treated them for malaria.
Sometimes even people self-medicate.
That's true. Yeah. That's true. Or they have treated them for a bacterial infection or typhoid or something like that. And so there's a bit of delay in that area. And then eventually they may start getting confused and have convulsions. And then maybe the healthcare workers working on them will be like, oh, wait, we do not know his HIV status or her HIV status. So then they do an HIV test and they find out that the person is HIV positive.
Yes. And so when someone has had these symptoms and they have presented to a healthcare worker, what are some of the ways we are able to test and confirm that they actually have cryptococcal meningitis?
So there's actually a very simple test which is called a CRAG test. And we usually start with the serum CRAG. We take a few drops of blood from the person's finger and then we test it. In 10 minutes we shall know the results if it's positive. When it is positive, then we will seek consent to perform a lumbar puncture. A lumbar puncture is inserting a needle in the lower back of a patient and you tap some cerebrospinal fluid, and you can also test that using the CRAG test. And when it's positive, then we have a confirmed case of cryptococcal meningitis and we begin management. So all this is done at the bedside of the patient, and within 30 minutes we have a diagnosis and we can immediately start treatment.
Thank you so much, Dr. Jenny. Ronald, what are some of the things you started feeling before you got diagnosed with cryptococcal meningitis, and how did you get diagnosed with that disease?
Musawo nagadya neyanze n'ekibuuzo ekyo kyombuuzizza. Nalwalira ebbanga ng'omutwe gunuma n'omusujja nga gunuma. Ne ŋŋendako mu kiriniki ezituli okumpi. Bwe ntuukaako mu ddwaliro ne bantandika okumpa eddagala erya Panadextra, ne nkozesaako Panadextra ne bampa ne potam nga bamanyi nti nina omusujja gwa malaria. Ne bafuba nnyo okunzijanjaba. Nze ndowooza nzijanjaba malaria, nzijanjaba mutwe. Naye ng'ekyamazima eddagala eryo nali nkozesa nali sifunawo njawulo. Oluvannyuma nalina olugendo nga ngenda Kasese. Nali mu saaluuni emu entinda nga bansalako emmere ku mutwe. Eyali ansala n'ambuuza, muzeeyi omutwe nga gwokya nnyo, guno omutwe sigusalangako gulimu ki? Ne mugamba nti of course nze nina olugendo lwe ŋŋendamu ne ŋŋenda ne nkwata takisi ne ŋŋenda e Kasese. natuuka e Kaseesi nagenda okwekangako okuba nga ategeera nga ndi mu Kirembe hospital. Ne mbuuza abasawo b'Ekirembe hospital wano natuuseewo nti ne baŋŋamba baakuleese nga oli mu kkoma ogenda kufa. Tusaali nabagamba bannange nsaba kuddayo Kampala kubanga eno gyendi siinaayo mujjanjabi. Nsaba mu nsi buli nzeeyo e Kampala. Era nekubirako nali ntandise okufunamu ku maanyi nina gwe nakubira nampeereza ssente nenninya lwindi nenkomawo e Kampala.
Thank you so much, Mr. Ronald, for telling us how you felt and how you actually ended up in hospital, which is very close to exactly what Dr. Jenny told us, that these people usually have fevers and headaches, which are usually like the worst headache of your life, and then they sometimes get confused, they can have convulsions, and sometimes even being unconscious. We are going to be back, and I encourage you, if you have not invited everybody you know, to invite them so that they can tune in and watch this segment of that talk show. Thank you.
Get value for your money by choosing the right paint. With Global Paints, you don't just paint, but paint for generations to come. Make Global Paints a paint of choice and make your building a paradise. We have weather coat emulsion, undercoat emulsion, silk vinyl emulsion, flat emulsion, super gloss and high gloss. Global Paint, a reliable product.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola patients. Any person who dies suddenly should not be buried but reported to the nearest health worker or LC1 immediately. For further information, please call the Ministry of Health toll-free number on 0800 100-066 or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from UNICEF and World Health Organization.
Thank you so much for being here, and thank you for sharing our Facebook, Twitter, and YouTube link up to the last person. I know that people have joined us and we are really, really, really grateful. Thank you so much, our guests, for being on the set and for telling us so much about advanced HIV disease and cryptococcal meningitis. This show has been brought to you by the Infectious Disease Institute, and we are so grateful because we have learned so much. We've learned about advanced HIV disease and cryptococcal meningitis. In our last segment, our guests told us about the role of diagnosis in management of cryptococcal meningitis, and many people fear getting lumbar punctures. Dr. Paul, kindly share what the role of lumbar punctures is in the management of cryptococcal meningitis with our viewers.
The role of a lumbar puncture, or removing water from your back. First, it is very important, like my colleague said, Dr. Jane, that currently in Uganda it's the only way we are going to find out or diagnose you that you have cryptococcal meningitis. That water we tap from your back is what we use to test, to confirm that you have cryptococcal meningitis.
Yes.
Because once you have cryptococcal meningitis in your brain, I would use an analogy of a sink and a tap. Normally in the brain, there are cells that produce water, more or less like a tap. And then there's a sink that takes away
the water.
How it works is that, if I may use an analogy of a tap and a sink, we all know a tap and a sink.
Yeah.
In your head or in your brain, there are cells that produce water, and then there are cells that take away
The water. Yeah.
But once you have cryptococcus or this fungus in your brain, the fungi will block the sink, but will not block the tap. So water will keep accumulating or will keep being produced, but it's not having anywhere to go. And the pressures in your head or your brain will increase.
Yes.
And that's why people will get the severe headaches, people will become mad, people will get seizures because of the high pressures in your head.
Yeah.
And it is important for us to do lumbar puncture to reduce the amount of water to bring down the pressures in your brain.
Yes. Thank you so much, Paul. You know, we've had some people complain that, you know, I saw someone have a lumbar puncture done and that person died. Some people complain about, you know, that they get erectile dysfunction. There are all these myths that are around, yeah? And it is important to us to actually understand whether these myths are plausible.
Yes, thank you very much, Dr. Nangani.
Yeah.
We get this a lot, especially for us in care. People will come and tell you, Musawo, won't I die when they take water from my back?
Yeah.
Especially now, my fellow men will say, Musawo, in the bedroom, you know. So, yes, a lumbar puncture, we do it. And we have seen people die earlier in early stages of HIV. Yes. But not because it was the lumbar puncture killing these people. No. Like you hear it, many people, it is the first time they are hearing it. Even those people, it was the first time hearing about the procedure, and people were getting scared.
Yeah.
In a wrong land, because they get scared, they will withdraw and take their patient maybe back home.
Yeah.
Then they will bring them at the end stage when they are dying or in their coma or they are unconscious, or a patrol found them along the road and brought them at emergency.
Yes.
They are in coma, they are not speaking. So we shall go ahead and maybe diagnose them with CCM, we do a lumbar puncture, but these people are already in the worst cases, the worst stage.
Yes.
They will end up dying.
Yeah, true.
But not because the lumbar puncture killed them anyway.
Yeah.
When we are doing this procedure, we do not okay, there's a slight pain when we are giving anesthesia or we are killing the pain at the place where we tap water. That's the only thing you feel. But after that, we shall tap the water in an aseptic place or a place which is very clean, because it is now our responsibility as the health workers to make sure that we don't introduce the infection in somebody's cerebrospinal fluid.
Yes.
And so after that, you will be okay. You will go home and you come back, and maybe if you need another lumbar puncture, you do it, and you live well. You do your work when you become better after.
Yes.
And life will be good.
Dysfunction, very important. Thank you so much for teaching us this evening, for sponsoring this week's talk show. We are going to be back. Until then, keep it right here. Thank you.
Did you know that a cashless, secure, and convenient lifestyle is possible with Airtel Money Pay? Pay for your goods and services in the following simple steps. Dial *185*9#. Enter the merchant ID. Enter the amount. Enter payment reference, for example, school items. Please enter PIN to confirm. You will receive a confirmation message for a successful transaction. Airtel Money. Instant, secure, borderless.
Welcome to the Living Room Stadium. It's the FIFA World Cup. The match is about to start. Food and drink ready. There's no space left for anyone. Come on, get your lucky chair. Take your usual spot. Even the puppy has one. It's preparation time. You can feel the tension in the air. And do you have everything you need to believe?
Seeing is believing, and it is exciting for us to have an ambassador from the Infectious Disease Institute as part of our set this evening. In our previous segment, we were told by Ronald how he started feeling ill, he got these headaches, and at some point he was actually unconscious, and he ended up in a hospital far away from his family. When he regained consciousness, he requested to be discharged so that he can return to Kampala. Omuganda agamba, golabyeko yabeera omwana. Mwami Ronald yalwalako obulwadde bwa cryptococcal meningitis. Naye yatukomye kutubuulira okuva mu ddwaliro lye. Mwami Ronald, biki ebyatuukawo nga bakuyise e Kampala?
Bwe natuuka e Kampala nagenderawo wa sisita wange waali e Matuga. Sisita wange nankwata nangamba togenda kudda waka, nina okutwala mu ddwaliro. Sisita wange yantwala direct Mulago. Bwe twatuuka e Mulago nga amaanyi gampeddemu, ng'omubiri gunnuma, ng'omutwe gunnuma gulinga ogwagala okwabika, nga baguteekako ekiwero kikala. Basooka kunkebera musaayi ne baŋŋamba olina siriimu, kkiriza obagaana, siriimu ye omulina. Ne bantwala ne baddamu ne bankebera ne baŋŋamba weetaaga kuggyako mazzi ku mugongo, bw'otokkiriza kuggyako mazzi ku mugongo ogenda kufa. Ani gwoze naye? Konze nze ne sisita wange. Ne bagamba sisita wange asayininge. Sisita wange n'agamba tekisoboka. Ne mugamba sisita wange wandeese mu ddwaliro, kati nze mulwadde sigwowulira obulumi bwenkola ki bwempitamu. Leka abasawo bakole kye bakola ki kye balina okukola. Nze ne ŋŋamba abasawo bwe mba nfudde kisoke, naye nze njagala kubeera mulamu, mukole kyonna kye mwagala, omubiri gwange ngubawadde. Ne baŋŋamba okkiriza? Nze nzikiriza. Ne nsayininga mu kitabo ne banjako amazzi ku mugongo. Omutwe gwali gunnuma, omutwe guluma. Bamala okunjako amazzi ku mugongo ne bandifaalinga ekiruddu. Bwe natuuka ekiruddu, abasawo b'e Mulago bakola nnyo, banfaako nnyo, naddala abasawo abava mu IDI bandabirira nnyo. Waliwo ekitongole kiri e Mulago ekyo ekya IDI kyanyamba nnyo, kubanga baavanga e Mulago ne bajja ne bankebera ne bajja ekiruddu mu ward 5. Natuuka ekiruddu mu ward 5, ekitaana namba 2 mu ward 5 awo abamanyiwo we nali mbeera ku kitanda ekyo. Bwe natuukayo ekiruddu ne nzibikira nemba nga sikyasobola kufuuyisa, ne banteekako akapiira. Yamala okunteekako akapiira ne baŋŋamba ekigenda okuwonya kukuggyako mazzi ku mugongo. Konze ekyo mukikola emirundi gyonna gye mwagala. Nze kye neetaaga njagala kuva kiruddu wano nga siri mu keesi, nga ndi mulamu. Ne nkwata obulamu bwange ne mbuwa abasawo. Abasawo ne batandika okunkolako misana kiro, ne batandika okuleeta eddagala, era neebaza nnyo abasawo omulimu gwe baakola. Ne batandika okunkolako. Kati nga bamaze okunkolako, natandika okuwulira ensigo ziri ezaali zinnuma nga tezikyannuma. Bajjanga ne baŋŋamba, Ronald, kayiso. Ne bankonako, natuuka ekiseera nga n'akayiso tekakyannuma. Saawa etuuse ne banziggyako amazzi. In fact nze gwe mulaba wano banjjako amazzi emirundi 12. Naye bino abantu bye batugamba, stories z'empulira eyo mu byalo wansi eyo, nti bwe bakuggyako amazzi ku mugongo ofa. Nze nsobola okulaga omugongo gwange essaawa zino bwe gukola era bwe guli. Banjjako amazzi emirundi 12, bampa fulukonazo ne mira eddagala lyange bulungi, era nze njagala obakakasa ali wano nti nawona mulalamu.
Amina.
Simulina. Kati bino bye balimbalimba abantu. In fact nandibadde musawo nagadya nsaba kuyimirira mu ndageki abantu abali eyo nti nawona era ndi mulamu, neeyagala, ndi fiiti. Okuva lwe bankebera lwanjjako amazzi ku mugongo n'amaanyi g'ekisajja bwenzira mu kisenge wali ndyoke sirina ttabbu yonna. N'olwekyo nze kyenkubiriza abandaba eyo mu Uganda yonna, abandaba essaawa zino, nti mugende mu ddwaliro babaggyeko amazzi. Tekirinamu sitaani, kikuwonya gwe, kikuyamba. Naye buli lwotya in fact oba ogenda kufa. bw'oba oyagala okufa amangu gaana okuggyako amazzi ku mugongo naye bw'oba oyagala obulamu bubeere ng'obwange amaanyi sina wannuma ntambula bulungi girlfriend wange yeeyagala mbuuza owaayi kati ennaku zino emirimu ng'ogikola bulungi nina essanyu naye tulekerawo okutya kyendaba nze kyendabye risaaki gye nkoze abantu batya okubaggyako amazzi naye twetaaga tubeere balamu njagala mwenna abali eyo mu byalo eyo abali mu Uganda yonna mugende mu ddwaliro mufune obujjanjabi bw'oba olina siriimu mira eddagala lyo ng'obudde bukyakola ki siriimu si y'enkomerero eriyo endwadde endala ezisinga ne siriimu amaanyi bw'oba mulwadde si y'enkomerero nti obulamu bwo bukoze eki buweddeyo si y'enkomerero kubanga naffe tubadde ne siriimu kati nze maze ne siriimu emyaka 2 n'eddagala naakalitandika emyaka 2 nendyoke nsobodde okubeerawo kwata siriimu mujje mu bwongo obwo mukasuka eri mu kasero gamba siriimu gwe nvaamu dda wali mu kasero awo ojja kusobola okutambula si buli alwadde siriimu nti yaweddemu amaanyi eri abafa accident eriyo be bakuba amasasi eriyo be bakuba emiggo kati n'ekirala tulekerawo okutya kyendaba ekisinga okutta abantu kutya nabana betubeera nabo batumalamu amanyi ogenda kufa oli ajja kukulekawo jjanjaba bulamu bwo totunuulira oli basebo ne bannyabo fa ku bulamu bwo kubanga nze senga nali nfudde ku sisita wange ngamba nti ogenda kufa we bakuggyako amazzi senga siriwo nina mutabani wange yamaze S4 namulabyeko nina essanyu nkyayina ebintu bingi ebyokukola naye njagala kuyamba abantu abo abali eyo mu byalo abali wansi abatamanyi kino kubanga nze ne experience mu kintu kino amazzi baganzijako girlfriend wange teyadduka wali tweyagala tupulaninga nakuzaalayo kaana kalala nsobola okutuula emirimu gyange njikola bulungi neyagala nina amanyi tewali kyoba musawo nagajja naye twetaaga okunnyonnyola abantu n'okubasomesa bwe bakuggyako amazzi ku mugongo ofa tofa ziri zibantuuko nga zituuse butuusi ti Katonda leero alina okugjawo n'ofa yensonga naffe lwaki weetuli twetaaga okubannyonnyola so omulundi omulala nja kusaba bwe mulaba mumpadde omukisa twetaaga tutandika okusomesa abantu nti mulala mwoyo w'obutiko awona naye awona atya awona bakuggyeko amazzi ku mugongo n'okumira eddagala lya siriimu basebo ne bannyabo boona batomiza eddagala lya siriimu ogenda kufa eddagala bw'oba olimira saawa 4 limire saawa 4 bw'oba olimira 10 ez'ekiro zukuka 10 alamu yo giteekemu akati ate ffe tubasinga n'obulamu kubanga ffe tulina eddagala lyaffe lya buli lunaku twejjanjaba buli lunaku kati mwabatamira ddagala mulabye kubanga ffe tulina eryaffe tuli balamu tweyagala basebo ne bannyabo mmaliriza akagambo kano mulekerawo okutya mwejjanjabe bw'oba oyagala okuvuga ku bbima bw'oba oyagala okuzimba ku kalina bw'oba oyagala okulinnya ku nnyonyi bw'oba oyagala okulya ku nkoko y'oluwombo weefeeko.
This has been an exciting and very, very, very educative talk show. And we have come to the end of our talk show. But before we leave, I would request our guests to give us some shorting remarks before we end this show.
Thank you very much once again for inviting us on this Doc Talk show.
Yeah.
To my wife out there, I love you so much.
Hey, Mama.
I hope I made you proud. Together with my son and my daughter Ethan and Julie. Yes, my parting shots. Advanced HIV disease to all of us out there is preventable.
Yeah.
But more so, we have been talking about cryptococcal meningitis.
Yeah.
The same way I will repeat, it is very, very preventable.
Yeah.
Provided you who is out there and you don't know your HIV test status, you go and test.
Sure.
But also for some of us who already know our HIV status, please adhere to medication.
Yeah.
Do not go away and say, I forgot my medication. Let the medication be the first thing you pack.
Yeah.
Please don't stop taking medication. Take the medication at the time you are told to take it.
Yeah.
Such that you are at a step where you are not giving
the virus,
yeah, a lot of strength to put you down.
Yeah.
But also, if you happen to have cryptococcal meningitis,
yeah,
this disease is curable.
Very true.
The drug is all over this Uganda regional referral hospitals. If you are out there and I think they're referring you to hospital, please go. The drug is there. The health workers know what they are doing. They will treat you and you get well. You just heard from Ronnie here. He was treated and is now alive and kicking.
Yeah.
Thank you to our partners, especially the AIDS control program from the Ministry of Health, together with our implementing partners, the Infectious Diseases Institute, and the Center for Disease Control, CDC.
Yeah.
Remember also, we have our app, the Advanced HIV Disease Toolkit.
Yeah.
It is widely on your Play Store and your App Store.
Yeah.
It is Advanced AHD, like capital letters, AHD Toolkit. Please go download it. Every information, even what we have not shared here, you'll find it there.
Yeah.
Use it for your information. Those who are interested in numbers, the numbers are there.
Yeah.
Thank you very much.
Thank you so much, Paul. It was a pleasure hosting you, Jenny and Ronald. I have learned so much, and I can say the same for our viewers across the nation. Thank you for tuning in, our viewers. It was a pleasure hosting this talk show. Until next time, Dr. Nagadia Catherine.
Regis Mutuzo, the Minister of State for Gender and Culture in the Ministry of Gender, Labour and Social Development, and I am a woman member of Parliament representing the people of Bunyangabo District. I am delighted to acknowledge that we're ending this year 2022 with a fully opened economy. But I want to warn that Ebola is still around and COVID is still also with us. And therefore, while artists are performing during these festival seasons, please follow the guidelines. Do not congest places. We still have a life to live. I also want to encourage parents that this holiday, which is going to take us 2 months, may have its own risks. And therefore, please, for the children who have returned home, give them your personal guidance. Do not wait for a hired auntie. Do not wait for the TVs to do it for us. Do not wait for other people in the household to do it without you. Be clear to them. Talk to them, keep them, and guard them jealously. Give them tough love. As we get into the festival seasons, as we celebrate, let's remember that January, February, our children will be going back to school. So reserve some money. You can even do early shopping for them. Yes, during this period, there is a lot of pressure from political circles. But let me assure you that those who were elected into office are still serving a term of office that is still running for the next 2 or 3.5 years. And therefore, don't listen to noise. Let's concentrate on work. Demand for service delivery from your leaders. But don't castigate them